in absolute terms, the number of cases reported at the airport continue to decline, maybe as a result of restrictions in travel and the fact that the PCR negative, we are tightening the control to ensure that they are really PCR results that they are bringing in. We have so far recorded 430. We recorded 430 in January, so that is where we are now. If you look at the previous month, we have 393 in December for the airport, but in January alone we have 430. Let's hope that with the decline, February will give us fewer numbers into our active cases. The schools outbreak, we still have limited outbreaks across the countries. We've had some cases in Upper West, Western and Greater Accra. Greater Accra, as I mentioned earlier, has cumulatively reported about 20 positives in a couple of schools, and the contact tracing and isolation is currently ongoing. We only have one person in Greater Accra who is currently undergoing treatment. When it comes to I think the protocols are very important, and we know that until the vaccines come, our face mask is a vaccine. When we had the last spike, when the face mask use went up, the positives also started coming down. Currently, we just done one on the 29th, although we did assess in the mandatory wearing of masks in the Greater Accra region, which is made a key center in Ghana. 6 target districts currently hotspot are Ayawaso, Korle Klote were the areas we went to. We visited 43 communities in Accra, lorry parks, bus stop, busy street intersections, overhead, under traffic lights. This is where we have a larger number of people in public and want to see what is adherence to protocols. The data collected on the 29th of January between 7 a.m. and 10 a.m., which is where there's a peak movement of people. We're also going to do some in the morning and the afternoon in the subsequent ones. So the good news is that about 42% of our people are now wearing masks appropriately. 36% were not wearing it at all, with about 22% wearing it, 22 not wearing mask at all, and 26 were not wearing correctly. So if I add both, we are looking at about almost 80% have the intention to wear. I mean, those who are wearing it improperly is still an intention to wear, and having a mask is a good sign. So we are seeing an upsurge in the use of the mask, and we hope it will continue and hit 80% appropriate use, and look at that. But when you look at the Ayawaso West, you can see that 57% are wearing appropriately. Korle Klote, 56%. Accra Metro is still low, 39%. Ayawaso East, 39%. Ablekuma Central, 31%. And the Ghana West is 29% wearing of masks. And you can look at the not wearing and then not wearing appropriately. So we looked at the community and location with proportion of persons observed who were wearing wearing masks. You can see that the largest number was University of Ghana, Agyapong area, and the lowest number is around some of the lorry parks around the country in Accra. Baleshi, etc., had relatively lower use of them if you look at them in those communities. And then you also look at the absolute numbers of people who are actually not wearing the mask properly, not wearing the mask at all. You can see that some of the mini markets, Nima markets, etc., are probably showing the highest number of 70,000, a large number not wearing the mask, about 73% not wearing the mask at all. These are the first one were the averages, but we are now going to specific areas to show you that there are certain locations where not wearing the mask is good. If you go to the GCB Towers area, you can see that the number not wearing is lower compared to the other areas. So if you look at the trends, we have moved off from I'm looking at survey 3 all the way to survey 8. We have moved from 18% not wearing masks, and we peaked at 72% in the survey 7, but that number has dropped to 36% now. If you look at those who are wearing masks appropriately, it was high as 44 before, and then it declined all the way to 10 to even at one stage 7%, but now it has moved to 42% again. So we are hoping, because of the scale, the two numbers have switched, but the 42 is for the green and 36 is for the red one. So that is so down the mask use. You can see we hope that to continue going up, and that will be a very good way of containing this thing. So in conclusion, compared to October 2020, the number of people wearing the face mask correctly have increased from 10 to 42%, and those not wearing the mask correctly have decreased from 72% to 36%. 78% of the people observed have intention to use the mask, and 20% of the people observed were not wearing the mask at all. And I think this is an important thing that we'll continue doing every third day to see how we move on. The proportion of people who were correctly wearing the face mask slightly higher among males than the females, and the proportion of people who were currently wearing the face mask slightly higher among children than for adults. Ayawaso West District registered the highest proportion of people who were wearing the face mask correctly at 57%. Gan West District registered the lowest proportion of people who were wearing the mask correctly. That's about 29.1%. The top 3 communities that had the highest proportion of people wearing face mask correctly were University of Ghana, Legon Entrance, Ponglo, University of Ghana, Legon Main Entrance, and the GCB Towers, that is in Accra. The top 3 communities that had the highest proportion of people not wearing the face mask correctly was the Nima Market area, the Lorry Parks, Glife Lorry Park, and Osu Market Entrance, which is a place that we need to look at. How are we working on the progress made so far since this surge? Data entry and linkage to care after the initial intervention of placing people have actually increased, and then after posting people to the labs. The Ghanese PCR lab has commenced working since Monday. We are doing more than 4,000, 3,000 tests already. A ban on entitled measure and adherence to protocols are in place, and we are seeing the benefit of that. For the school outbreaks, I think I mentioned it already. We have about 34 contacts we are currently following. We continue to expand our testing capability, and the reference labs are working in 24 hours. We are having some challenge with people just walking into the labs, and you will get up in the morning, the whole place is full with people wanting to test. We want to appeal to people that you must meet a certain case definition. So walk into any other place, and then you'll be requested, or the sample will be taken, so that we can have, we don't want people going to mass up at the testing center, and that becomes another place where you might even go and pick the virus. So go to the nearest health center, the sample is taken, or you'll be referred to the place to have it, so we can have some, we're initiating the antigen test in certain centers for specific groups of people. And then, as I say, want to ensure that testing is free at all our public lab places. The PCC Isolation Center is ready for use, and I will appeal that anybody who still has the reason to test, please self-quarantine. If you think, especially for those who do a walk-in, if you have any reason that you have to test yourself because you are exposed, or you heard somebody you met, and then we look at that, and we want to assure people that we are also ready to respond if we have this information early enough from you. So thank you very much, Honorable Minister.
Thank you very much, Dr. Patrick, for that update. Just a couple of points that I would make, even as I reiterate a few things he's mentioned. This week as well, you would notice our government is stepping up messaging on COVID prevention etiquette. This includes mass media messaging, and then also through the Information Services Department, vans out there to step up the message so that we get a lot more compliance to the mask wearing mandate. We want to ask you, our colleagues in the media, to complement this as much as possible with your own programming and infomercial support, as you have been doing and as you used to do very intensely from, I think, March, April last year. We want to ask you that as we step up messaging from this week, you also assist us with a complement of that. Now, just to reiterate a few key things. Doc, so the top line number today is 5,000. The top line number today is what? 5,500 and what?
And 15, I think, yeah.
5,515.
Now the active cases.
Yes, that's the active cases now. We're still sitting around 700 per day, according to the data that we have, and it's important to arrest that and begin to bring it down. The way to do that, among other things, includes the observation of the preventive etiquette as has been laid out. In particular, the workplace admonitions that have gone out, shift systems at work, virtual platforms at work, because as has been mentioned in recent days, there are a lot of workplace-related outbreaks that are still being observed. And so we want to reiterate to the managers of workplaces that the shift and virtual options should be introduced to help us contain the workplace spread as well. For the President's instructions on social activities, I think they've been quite clear, save for a few clarifications or a few requests for clarifications, which we will deal with this morning. And just as we get into that one, I just want to explain what the public health officials have been telling us. If I'm wrong, Doc can correct me. That a lot of the recent positive cases can be traced to social gatherings.
Yeah.
These are people who go to events, first of all, wearing their masks, their temperature is taken, sanitizer is used, and then at some point in the event, they will sit down for food and drinks and take off their mask and start chatting and engaging, and droplets will be flying from somebody's mouth onto somebody's plate or whatever, and will be floating around, and before you realize, people are getting cross-infected. That is the reason for which social gatherings of that nature have been banned. So, for example, you'll notice that the President did not ban burial services, because the activity of burial, we actually encourage you go on, so that you don't have people's mortal remains, piling up in the morgues, etc. The activity of burial, so the burial service, the one where you take the body, most likely to a church, and a prayer is said before they will go and do the actual burial, that one is not banned. It is only limited to about 25 persons. So a private burial or a private burial service is not banned. What is banned is the funeral, where typically in the Ghanaian community, we will all gather, you see a long line, shaking of hands, announcement of people, then they'll call for a song, people will come and dance, then there's lunch or dinner, food and drinks, alcohol. There's a little party associated with it. That is what in Ghana typically we refer to as a funeral. That is what is banned, because it is that aspect that we notice that there's that high risk, and therefore people are being traced to similar activities that have caused spread. In the same way, when it comes to marriage, the President did not say that marriages are banned. The President didn't say that. What the President has said is that what we call in Ghana the wedding, the full-blown wedding where you have a big party with reception and people dancing and people eating, sitting at reception tables, etc. That is what has been banned. We've got a lot of requests about, so what if somebody's having a that has been banned. That has not been banned. The wedding, the full-blown wedding with its reception and all of this social activity, associated with it is what has been banned. So we're taking time to explain the rationale so that we are all guided accordingly. It is in that same spirit that parties and I think concerts and related activities which put people at risk have also been banned. So based on your queries that have come in, this is a quick clarification that we are giving. Church services continue to take place and the COVID protocols apply. Registers must be taken, people must be masked up at all times. We are noticing that there are many church services in which choirs are out of their masks and are singing and spreading droplets all over the place. We want to encourage you that everybody is expected to be masked as part of the church service. The time limit still applies. The register must also be kept so that should there be an incident, it is easy to trace person. So just a quick clarification, but we are in good time to take your questions. May I ask my colleagues to set up the microphone and then we can take your questions now. If there are questions. Yes, sir. Number one. Number two. Number three. I want to take some new suspects first. Okay. We are the regular suspects, so let me take a few people. Are there any other takers? Any other takers? So please join us. That's number four. And please spread out a bit for us.
Thank you, Doc. I would want to find out if there are figures to buttress the workplace outbreaks in terms of absolute figures and then the percentages of our current active cases. And then when we say workplace, does it include the informal, let's say the marketplaces, the fitting shops? And then if it includes that, how are we going to ensure the rotation system we are proposing for those in the formal sector? Thank you very much.
Thank you very much.
Honorable, good morning.
Morning.
Your friend JC from Accra FM. Honorable, my question is, schools ni bebre complain say still na PPE is no monsan kan then I buy no ye senior bear anyone no one sabit me aka PPE is no more to me dia bo ho ban na biom Moche Workers Association almost ka say amanfo bebre na nya COVID na omo report e wo hospitals omo tinefie so ebi mo tinefie na omo awu but an Ghana Health Service into me record sa death no then Ghana Health Service send your bill to me record sa death omo mo tinefie omo to me report to hospital no omo no
but omo explain kwan omo fa so hu say nipa wu ye we COVID na
omo say
omo suspicion okay.
Good morning. My name is David Battels from The Finder newspaper. My question has to do with the President's address on Sunday. He mentioned that we're hoping to receive our first batch of corona vaccine by March. At the moment, there are about 9 vaccines, approved vaccines that are being used across the world. He failed to mention, we have AstraZeneca, we have Covaxin from India, Sputnik from Russia, and a whole bunch of vaccines. Sinovac from China, yes. My question is, which one is Ghana going for?
Or which combination is Ghana going for?
Exactly.
I hear you. Yes, go ahead, sir.
Yeah. My name is Ataminsa from Ghana News Agency. Yes, on 31st, that's when the President spoke to us. He was emphatic that the UK and then other variants are in the public or are being spread among the population. I want to find out, because the Ghana Hospital told us they are conducting genome sequencing. So I want to find out if you can give us update on the test so far and how wide this new variant has spread among the population.
Okay, so how widely spread is it?
Yes.
Okay.
Yes, and my second question is on, I learned yesterday that Food and Drugs Authority has approved first herbal medicine for clinical trial. There are concerns from a section of the public that they have expressed fear that the global pharmaceutical cartel might rubbish the efficacy of our herbal medicine because it is not coming from the Western nation, Europe, America. And so they might try to rubbish it and even disregard it. I want your take on it. Ghana Health Service, your take on this issue. Thank you.
Thank you. So first question, can we mine the data and provide some details of the workplace spread? There's a second question about, when we say workplace, does it include open air workplaces? Doc, I want to add something to that question. There are also some questions about how risky open air places in general, whether they are workplaces or not, or open air places in general, how risky are they? I think while you are dealing with the first question, you should add that to that. Jesse asked a question in Chi, so I'll take that one about inadequate PPEs. Jesse, Ghana Education Service for my Aswati say, or more air monitoring from this week. Normal here, say near man or more send the call, no. Ubi answer can I say schools and Sakan. I'm said that DG by no say. Do I send the car na kudu kumase? I feel now almost friend is a school bay and an insanka. It's almost monitoring. Your mom bear na watch and I say echo bear na watch me. No bank crime. Be na say omo data na ba. I hear number ba no mo disa data no. The abraying. And sana now bisa question. And major ma Dr. Boaji say mortuary workers bise omo susun esro say. Kofo bi munya COVID omo report ni bia omewu na ekwan be na Ghana Health Service efa so a capture sa data no data ni mu. But doc, I want to add to that one. Is there anything that is being done to assist mortuary workers so that even if you know or don't know specifically that this person is a COVID related death, they are also protected while they go about their work? I think it will be a natural follow-up to that first question. And then there's a question about vaccines, which type or which combination of vaccines. So what I do know is that the team working on the vaccine rollout program has done its work and submitted a plan to His Excellency the President. The plan was reviewed on Friday at the task force meeting. But the President has tasked them to do some further work on that plan before he himself will make a full detailed announcement. As I've said over and over again, under the task force, there are subgroups that work on various things. And they always come back to the table for their work to be interrogated and validated and sometimes sent back to go do some more work on it. So they've done a lot of work. They've presented a plan. The President has asked for some specific items to be validated on that plan. And then he himself will lead a full announcement of the rollout, because this is a very big deal. So until then, I will not be speaking to questions of which type or which combination, but they are matters that have been dealt with in the proposal as submitted and as validated, save for, I think, about 3 items that he wants them to clear up and come back to him. Doc, the other questions of how widely spread, and then the FDA clinical trials, there are worries that the global pharmaceutical community may rubbish it. I'll let you have your take before I add to that one. Let's go.
Yeah, thank you very much. Let me just talk about the workplace area. The workplace is a very, very good area to harvest cases. We will be able to, we can tease out those numbers. But what we know is that if you are going to have 10, 20 workplaces reporting cases and following them up, sometimes, even as we speak now, we are still following up contacts of them. So you'll not be able to give you the full number of people who have come. But what we know is that a significant number of hotspots are taking place in the workplace. One workplace can give you 700 cases, okay, compared to a household. And so anytime you start reporting workplace outbreaks, it becomes problematic. We have them, I cannot put names of organizations and companies that have had outbreaks on air. But what we can show you that is a lot. And it's an ongoing process of not just counting the number of cases in that workplace, but also going to their homes and where they have to see how that outbreak has impacted on the general thing. So if you want to just mind and say, because of that workplace, you have 20 of them, you know, because one person who got infected at work will probably go to other places. He has a gym, he has places, he has friends, and these are all that we track. And so it is a very, very important area we must look at. And that is why we are always making sure that it's a good. The last October-November hike was purely, every place was quiet, purely workplace outbreaks that was harvesting the cases that we're having. Yes. Before I come to the open spaces, and for that, that is why we insist that anytime there's an outbreak, they should call the health care team to come in there, do an assessment of the case, the primary contacts, secondary contacts, and then follow up to their homes so that the response does not end up in the workplace. So when HR managers, like I keep saying, call people to go home and go and test and don't come, you shortchange the contact tracing because it goes beyond that. We are also saying that apply the protocols in workplace, wear masks all the time. Where possible, avoid crisscrossing. You are in the workplace. You are moving from one office to another. If you can avoid it, stay so that we can also reduce the number of mixing. As a one there's an outbreak, we come. We always look at cases, we do case investigation for every case. And what we know for a fact is that spread in these open places like markets and trend is low. I'm not saying it's zero, but it's a lower, much, much lower risk area for spread of the virus. That's why even in schools, etc., one of the main recommendations, make sure you have good ventilation. Even if you are in a vehicle, that the windows are open so that you can have proper ventilation. That clearly reduces the rate of transmission. And that's what makes those open places a low risk compared to an indoor place like here or like workplaces where people are in offices, closed, open, people are opening doors and coming out. That is where the contacts and the people are much closer together to look at. So it is that. And it is not about the way you feel or what you think. It is about the data. If you start seeing cases coming from those places, then you can say, but as long as you cannot see cases, as long as you cannot do investigation and trace outbreaks to churches, you cannot say the church is an open place that people are, the place that we are going to. And that's what we are talking about in terms of these open places. When we start seeing the risk going up, we will announce. But as far as our data is concerned, as far as our case investigations are concerned, these places are low risk for now. The mortuary workers. We have a way of managing all those that are known COVID. And for people who die at home, we have primary prevention approaches so that you assume that it could be anything. It could even be Ebola. And so that is why the management is done in such a way that you don't treat it just like anybody. You wear your PPEs, you protect yourself, and it is done until... So you are not allowed to just manage the body anyhow. You are supposed to wear your PPEs, and that's what we use in protecting them. Their boots, their gloves, the mask, etc. They are all available for them to use. And especially when you don't know the cause of death, you treat it with the highest level of contamination, that this is likely to be a contaminated case. And that's what we do. And so there's, unless you are careless, then that is when you have that problem. So that's what it is. Honorable, you mentioned you arrested...
How widely spread is the new variant?
Yes, the new variant. According to the last study, we've done two sects. The first one was those we isolated at the airport and tested. That's we found cases there. When we move into the next stage of looking into the community, we realize that the UK strain is widespread and is slowly becoming more dominant, and that is what we are seeing. So yes, it's becoming more dominant, and that's what the mutation takes place. They mutate and they try to take over and become more dominant, and so we expect that it's going to be, the way it is spread, it's going to be the more dominant feature. So we need to prepare for it. The herbal medicine. every country has, not every, we have an FDA, which are, even if those so-called big drug companies that you are talking about, if they bring their medicines here, FDA will still test them and approve them. Once it's approved, it's up to us as the people to trust the medicines we produce here and use them. And so I don't think there's any. In fact, if they find some value in it, they'll even try and probably even buy it and promote it further and make more profit out of it. So I don't think that if it's efficient, if it's efficacious and it's effective, nobody will rob it, because it comes with the science of it. The clinical trials will tell you exactly what it can do, how safe it is, and so I don't think it is. We should worry about that. If we trust it, let us use it. I think that's it for now.
Those will cover it. So if there's a second batch of questions, now is a good time to take it. And while I wait for the second batch of questions, just a couple of comments. Now, because there is the very high possibility that as the UK variant becomes widespread, or a lot more widespread, it could overtake the traditional variant. And we are noticing that it has a higher rate of spread.
Yeah.
And it appears to be associated with a higher disease burden.
Yeah.
It means that instead of lowering our guard or thinking that, we figured this thing out, all of us actually now have to step up our guard. Because what is now around and creeping around is a bit more dire than the first one.
Yeah.
So if your compliance level was at 5, when the manageable version was around, now that what appears to be a more dire version is around, I honestly do think they have to step up your compliance level beyond the 5 and not drop it. So we are pleased to see that the wearing of masks is gone up, but we think we are not there yet. A lot more compliance needs to be urged so that we get the results. The microphone is being set up. If there's a second batch of questions, 1, 2, Manuel, are there others? 3. This is the final batch. So if you have a question, now is a good time to have it come forward. I'll give you the final word. 4, Arthur.
Yeah, good morning, Honorable Minister.
Morning,
Dr. Boji. This morning I heard from a radio station some affected frontline workers saying that their compensation rate has been reduced. In fact, some of them even complained that haven't had it at all. Those who have been affected or have contracted the disease, and those who have died. How true is this? And can you give us figures of those frontline workers who have actually died, who have been affected, the figure so far, if you can give it to us?
So the first part is that there are some persons claiming to be frontline health workers who say that their compensation has been reduced.
Yes.
And then there are others who say they have not received it at all.
all.
Okay, so that's in 2 parts. Before the third question, can we share data on health care workers? Yes, sir.
The first instruction that the President gave when he did the lockdown, it affected some gathering. In fact, he couldn't even church gathering. And now this time around, it's like he has loosened it a bit, go to church, but funeral and things have been banned. What informed that decision? Because people were saying that if it's a complete prescribing public gathering, then churches and mosques should be included. Why this time around? The decision has been a little bit lackadaisical. Thank you.
No, it's not lackadaisical. It's varied. It's varied. I think our choice of words should be better attended to. I don't think you were in here earlier when I explained what the data is saying about the risk levels. Chief, are you with me? I'm answering your question. You were not in earlier when we explained what the data is about risk levels. Remember in March when we went on the precautionary lockdown, we needed to understand the dynamics of the virus, how it operates. Haven't gotten an understanding, the task force is in a position to then say, okay, schools can be reopened, but this must be done to mitigate the risk. You can go to church, because in the beginning when you didn't understand anything, you say, anything is possible. But now with the knowledge you have, you can say schools can reopen, but these are the preventive etiquette that must be put in place. And you may have a number of cases, but this is how you contain it. And that's what the data is saying, about 3 cases or so far since schools were reopened, because there's knowledge on how to manage it. For example, there's knowledge now that even on a public transport with good ventilation and people wearing masks, the risk level is very low. In fact, lower than those of us sitting in this air-conditioned room, this closed air-conditioned room, even with social distancing. Yes. True? No? Yes. So it's the data, the science, not how we feel. That because I feel that this must be the reason, then this must be the reason. No, the data is leading them directly to the point where it tells them that, therefore, you can go to church with adequate social distancing and people masked, registers taken, screening taking place, people washing their hands, etc., before they go in, and it will be less risky than those of us in this closed air-conditioned room who are here. That's what the data and the science is telling them. So it's not about what I feel. It's about what the data says. Manuel.
Great.
Doc, I'll come to you for the first 3 parts of it, the reduction. I'll come to you later on it. I just needed to deal with this quickly. Manuel, go.
Just because you mentioned the public transport, there's a question about the ventilation. I mean, which better place you have ventilation than the beaches, but they are closed. And so how do we reconcile that position of closing the beaches and then allowing public transports to operate at full capacity? Again, how do we reconcile the data from the numbers that we're recording at Ayawaso West? At the last briefing, it had the highest. But this time around, the new survey that you conducted said they are the most compliant to the wearing of face masks. How do we explain that? And last week, Honorable, you mentioned that it just clarified that the idea that frontline health workers were going to be the first to receive the vaccines was only a suggestion, which a recommendation which government was considering, and that by the end of the week would have gotten that. We want to know, do we have confirmation on the protocols with which you are going to distribute the vaccines, and how is that going to be done? Thank you very much.
Thank you. I think you had stepped out when I answered that question earlier. So I'll share with you the answer subsequently.
Okay, my name is Eric. I work with Star FM.
Yes,
Doc, you shared with us a percentage of child cases earlier on. I was hoping if you could kindly reiterate that for us. And there's also an indication that with the cases, the reported cases at the Komfanochi Teaching Hospital, there could be a potential surge in terms of infections amongst children. Is there a cause for alarm in that regard? And also with regards to the schools that have been open, there are instances or there are communities and schools where some of the children are above the required 30 students or 30 pupils in a class, and that doesn't make room for social distancing. Considering that we're seeing cases being reported amongst children, is there steps going to be taken by the Ghana Health Service in that regard to decongest the classrooms? And then Nana Poku asked a question about health workers. We spoke to a doctor yesterday who was raising concerns that the allowances and other things were not coming, and as such they are threatening strike. They didn't give any dates, but the doctor says that as and when they decide to strike, the nation will hear about it.
So I think it will fit into the first question that came up. On the issue of classroom sizes, I'll pray you that we defer to the Ghana Education Service. When they come back from their survey, they were with us, they told us they are going on monitoring. So when they come back, we can deal with that one. This is the final question.
Yeah, thank you. Look, now that it has been established that the UK variant is dominant and it has higher disease burden.
Dominant.
It's
becoming
dominant.
Widespread. And that it could become dominant.
Dominant.
It could fade away the old one and become. He hasn't established that it's dominant.
Okay. Can you tell us maybe communities that it is getting widespread? If you can tell us the communities that are getting this new variant and how you are going to contain it, because it is dangerous. Then in one of your updates, you mentioned that 32% of people who are getting COVID are getting sick or are falling sick. What is the current situation? Is it going higher or it is coming down? Thank you.
You're showing me that you are on top of the data. Doc, I think you can handle all of it for us.
Yeah. Thank you very much. In terms of the compensation, we had defined who a frontline health worker was. The president had given a tax rebate that was up to December last year, and we had frontline workers. The frontline worker data is generated on monthly basis based on who was on duty, who at the month was frontline worker. A lot of people have been paid. We still have some people who we have a few challenges with account numbers, etc. And there's a lot of work going on to make sure that they are all paid. And so yes, we know that there are people who have not been paid, and there are specific reasons why, and they are all being assured that the payment is currently being done, so that they all be paid very soon. In terms of the number of health workers, it changes by day. But the last update I gave you, we had about 3,700 plus health workers who had been infected. The number of deaths keeps changing, but we'll look at that. But there's also the insurance component, which is currently being worked with the ministry to ensure that those who deserve compensation are compensated, and that is currently in the works, and with the insurance company that insured them. And so those still are ongoing, that is happening. So we've had cases. Of course, in this new surge, we're going to have more health workers getting infected. And so that is why we are also advocating everybody to improve the protection and protocol so that we don't have a spread that affects us. So that is the number. We have about 3,800. It may change as we are speaking now. And so, and when the number changes, when we have accumulated number, we'll be able to share with you. The Ayawaso West, the number is, I would say, more of an artificial number. When we subsequently disaggregate them, this is not. It's so because Noguchi and Nyaho Clinic is located there. Yes. So they tend to record a lot of cases there. But after we have received the results, we look at their location and redistribute them. So Ayawaso West is not a hotspot. I'm sure today you didn't see me post in the last few days. I've never posted this, but on the update, because of the way the reporting is done based on the labs, you think that's Ayawaso West. But clearly it is not. It's just because the labs are there, Noguchi, Nyaho, and some private facilities are there, and that is what creates that number. And so one would not say that Ayawaso West is a hotspot, or is it Kwale Klote and the rest, because we also have the Akai also reporting there and closing the numbers. So that's why when we look at, we disaggregate, you realize that the central Accra and the adjoining districts, that's where we had a problem. Of course, that will include Ayawaso West, but it's not a hotspot, one will say. So I think we need to make that thing quite clear to you. Yes. Like I said in the presentation, as far as our current numbers are concerned, the proportion of children has still remained the same. I think under 5 is under 2% or so, still quite low. And the Konfanoche figure is 11 out of 200. It's 11 out of 200. That brings it down to about 5 or so %, which is the same as we have when we look at 15 and below, much lower than that. So, and we do not have significant increases in, like we mentioned, for outbreaks in school. We've mentioned the number, and we have a very, very, very active surveillance system that is quickly able to pick up any possible case and then quickly identify, including contact tracing. So that, for example, if we found somebody positive and a child is a contact, we automatically link up to the school and do our contact tracing and isolation if we need to. So those are the things that we are doing. So I don't think that there's any cause for alarm for our schools. When the numbers are changing, we will be there to let you know, and then the appropriate recommendations will be made. The percentage sick, the community with a variant, that is going to be a very, 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 you can't do genome sequencing for everybody. So we'll do sampling of the cases and do that. So we cannot tell you now that the variants are more in Osu or in Tafu or whatever. but we know that it's becoming an increasing phenomenon. And so if you get a new variant, if I get a new variant and you are my contract, I'm likely to give it a new variant. And that's how it becomes, because it's more efficient, it tends to override the older version that it came in. So that's the information we can give you. Yes, the percentage that is percentage sick has increased from the first wave that we had, from about 20% to about 36%. That is if you add all the mild cases to it. The number we don't think has changed much. But as the number of positives come down, we expect that the number sick will come down. And also, we are more worried about the severe and critical. And that's why we continue encouraging people that don't stay home. Don't hide home. When you are positive, come for triaging. Let us do the initial assessment for you. And then the doctors will tell you, stay home, we'll follow you up, or we want to keep you. And I think if we do that, we'll reduce the number of mortality and the number who progress from mild to severe and critical. And that will save more lives for us. Thank you very much.
Thank you very much. Colleagues, as we wrap up, one bit of information that I think you really need to help us get to your audiences. Today, our active case count is 5,515. We used to have a lower active case count when the widespread variant was associated with a lower disease burden. Now, we are being told that the second variants are widespread in the community and could become the dominant variant in the system. And it comes with a higher disease burden of about 32%. So if our active case count goes up or continues to go up, the situation will be a lot more dire than it is now. Please help us spread the word. As I mentioned, government is stepping up messaging. We beg of you also to complement this with your own programming and infomercials, like we started this journey together, so that we can get a lot more compliance and bring those numbers down. We thank you. God willing, on Thursday morning, we most likely will re-engage on this and other matters. You know, the President has nominated about 14 people for the Council of State. We're looking forward to the election so that the full council can get together and commence work. The President is also in the process of forming the government. Beyond the names that have gone to Parliament, he's making some other appointments that we'll share some details with you on Thursday. So thank you. We'll see you on Thursday.